Hi, I'm Dr. David Sparks, and I'm here to talk to you about obstructive sleep apnea. In our last couple of episodes, we talked about snoring. If you think snoring is bad, believe me, you will not comprehend what obstructive sleep apnea, or OSA, I'm going to be using that term a lot. OSA means obstructive sleep apnea for short. Same scenario as snoring when it comes to the upper airway. Fall asleep, all soft tissues in the upper airway, soft palate, uvula, side walls of the pharynx, they sag, they collapse, so the airway literally gets seriously constricted. But now enter the tongue, which is the main culprit in sleep apnea. As the apnea patient falls asleep, the tongue relaxes and lolls or droops backward into the airway, not only restricting it, but completely closing it off, completely. The result? Breathing altogether stops. It is terrifying to watch, believe me. I've observed patients in my sleep laboratory during a sleep study stop breathing for up to 90 seconds. Then, all of a sudden, they, sorry, but that's true, they gasp, sucking in a huge gulp of air. Bedmates, often wives, think that their husband has died, so they give them the elbow jab to stimulate breathing again. And by the way, just because you snore does not automatically mean that you have obstructive sleep apnea, but if you do have OSA, it's almost certain that you snore. So how often do these events of breathing stoppages occur during the night? Once or twice? Try this, cowboy. Mild obstructive sleep apnea is defined as 5 to 15 times per hour. Moderate OSA is between 15 to 30 times per hour, and severe obstructive sleep apnea is greater than 30 times per hour. Some patients can have greater than 60 events per hour, which, doing the math, turns out to be once a minute that you stop breathing. So if you have obstructive sleep apnea, do you really think that you're sleeping? Let's look inside the body during this complicated disease. And yes, obstructive sleep apnea is a disease, which produces other diseases and conditions. You know that blood flow is responsible for providing the entire body with oxygen. Hemoglobin is a red protein in the blood that's responsible for transporting oxygenated blood out of the lungs to the rest of the body. So, you breathe in, and oxygen bonds with hemoglobin, and the blood's oxygen supply is replenished. Stop breathing, and the oxygen gets used up. Now, turns out your brain uses 20% to 30% of all the oxygen in the blood in your body and needs a constant supply of oxygen. As little as 5 minutes without oxygen can cause some brain cells to die, leading to severe brain damage. So the way I like to think about it is this. The apnea patient stops breathing. Subconsciously, the brain, which is sensing an oxygen shortage, panics and calls for the heart to beat faster in order to get more oxygen. And here's the weird part about it. Even though the heart speeds up, it's not providing more oxygen because the patient, yes, the obstructive sleep apnea patient, isn't breathing. In a last-ditch effort, the patient's brain arouses and he or she gasps for air. Like that. Then the cycle starts all over again. Think about it another way. In effect, the obstructive sleep apnea patient is making his heart continuously race. It's kind of like doing wind sprints all night long, making the heart beat wildly each time breathing stops. Remember, one of the biological purposes for sleep is to allow the heart to slow down and get some rest at night. Now let's turn to the actual influence all of this has on sleep itself. Remember the 5 stages of sleep that have been programmed into the brain. Surely you can understand that the patient with obstructive sleep apnea doesn't cycle through these normally. Let's say, for example, the OSA patient drifts into stage 1 and then starts to progress to stage 2. At that point, the airway shuts down and breathing stops. Wind sprint, arousal, gasp. No more stage 2, let alone getting into stages 3, 4, and rapid eye movement. And what about all those hormones that are supposed to be produced and metabolized during the various stages of sleep? Hormones that are necessary for the body to function properly. You know what? Forget about it. What about the consequences of obstructive sleep apnea? First, and most obvious, since the patient is not experiencing good sleep, he or she has excessive daytime sleepiness and low energy. And on a side note, by the way, one of the deep, dark secrets of the trucking industry, in my opinion, has been their failure in the past to address this disease. I've called about 20 national trucking companies in the past, and I've asked about what they're doing to address OSA. In every case, I was given the cold shoulder by the official to whom I was talking. But think about a trucker's life. They spend vast amounts of time being sedentary, sitting behind the steering wheel for hours at a time. And then they eat at a lot of truck stops, where the menu is far more likely to feature corn dogs and fried chicken than salads, broccoli, and 93% lean hamburger. So what's the result? Through no fault of their own, a lot of truckers gain weight. And remember, it's not just confined to the belly. Fat also accumulates around the airway. End of story? When you see a jackknife semi on the highway, it's probably not because of the driver being unskilled. A lot of these accidents occur because the driver has obstructive sleep apnea and fell asleep at the wheel, literally. Even if you're not a truck driver, do you ever drift off while behind the wheel? Ever fallen asleep at a red light? What about forgetfulness? Researchers from New York University studied data from people between the ages of 55 and 90 who had Alzheimer's disease. They found out those who had suffered from obstructive sleep apnea were diagnosed with mild cognitive impairment an average of 10 years earlier than people without sleep breathing problems. A very common complaint from OSA patients is that they can't remember things. Now, we covered the chain of events surrounding REM sleep, or dream sleep, where short-term memories are sorted out and processed for long-term memories. OSA patients rarely dream. So what does that tell you? Forgetfulness is a daily problem. Obstructive sleep apnea alters glucose metabolism, promotes insulin resistance, and is associated with development of type 2 diabetes. Obstructive sleep apnea is a recognized cause of secondary hypertension. OSA episodes produce surges in systolic and diastolic pressure that keep blood pressure levels elevated at night. In many patients, blood pressure remains elevated during the daytime when breathing is normal. High blood pressure can also cause blood clots to form in the arteries leading to your brain, blocking blood flow and potentially causing a stroke. Getting back to dementia, narrowed or blocked arteries can limit blood flow to the brain, leading to a certain type of dementia called vascular dementia. And remember that little blue pill? That fortunately is now generic so that OSA patients who need them can more easily afford them? Well, erectile dysfunction is quite common in men who have OSA. In 2009, a research study found that 69% of the men being examined and had obstructive sleep apnea also had ED. Also, poor sleep, such as that caused by sleep apnea, can reduce testosterone levels, resulting in poor erections and decreased libido. Sorry to get up close and personal, but hey. Lastly, heart racing, high blood pressure aren't exactly the formula for a healthy cardiovascular system. Patients with obstructive sleep apnea are far more vulnerable to middle-of-the-night heart attacks. Can you believe that? You know, there's an old expression, lucky old Joe or Bill. He died peacefully in his sleep. Well, in the last few decades, we have come to realize that lucky old Joe or Bill may have died in his sleep due to a massive coronary after years of living with untreated obstructive sleep apnea. So you be the judge. Uncontrollable weight gain, daytime sleepiness, forgetfulness, erectile dysfunction, low sex drive, risk of type 2 diabetes, high blood pressure, stroke, and middle-of-the-night heart attacks. My snoring doesn't bother me. It bothers her. Think again. Next episode, we're going to talk about what we can do about obstructive sleep apnea.